Myopia versus hyperopia. Key differences and how to fix vision. Why can some people clearly read a book but struggle to see distant mountains, while others find it easy to spot faraway objects but can barely focus on nearby text? Vision problems like myopia, near-sightedness, and hyperopia, far-sightedness, don't just impact daily life, they shape how millions experience the world. Join us as we explore the fascinating mechanisms behind these conditions, uncover surprising remedies, and share practical tips to keep your eyes healthy and sharp. By the end, you'll not only understand these conditions better, but also learn how to protect your precious vision for years to come. Disclaimer: the information presented in this video is for educational purposes only and should not be considered as a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider for any questions regarding a medical condition or treatment options. By watching this video, you agree to use the information responsibly and acknowledge that the creators are not liable for any actions taken based on the content provided. What are myopia and hyperopia? Have you ever stopped to think about how your eyes capture the world around you? What if the camera-like perfection of your vision suddenly became blurred? Why do some people struggle to see distant stars while others strain to focus on a nearby book? Let's dive into the captivating differences between myopia and hyperopia, two conditions that challenge our everyday view of the world. Vision works as a complex yet seamless interplay of light refraction and perception. Myopia and hyperopia are two of the most prevalent refractive errors that disrupt this process. Myopia. 1. Definition. Myopia, or nearsightedness, occurs when light entering the eye focuses in front of the retina instead of directly on it, causing distant objects to appear blurry while close objects remain clear. 2. Mechanism. Myopia arises due to multiple factors. 1. Excessive curvature of the cornea. A steeper corneal surface bends light rays too strongly, causing them to focus in front of the retina. 2. Elongated eyeball. When the eyeball is longer than normal, light travels a greater distance, leading to a focal point that falls short of the retina. 3. Increased refractive power of the lens. Conditions such as nuclear cataracts can alter the refractive index of the lens, enhancing its focusing power and misdirecting light. These factors collectively disrupt the optical system's balance, preventing parallel light rays from distant objects from focusing on the retina. This results in blurred distant vision. Reference: according to the World Health Organization, WHO, and research published by the Mayo Clinic, environmental factors like prolonged near-work activities and genetic predisposition also contribute significantly to the development and progression of myopia. A notable reference is The Myopia Epidemic by Dr. Ian Morgan and colleagues, which explores the rising prevalence of myopia globally and the environmental and genetic factors contributing to its growth. Hyperopia. 1. Definition. Hyperopia, or far-sightedness, occurs when light entering the eye focuses behind the retina instead of directly on it. 1. This causes close objects to appear blurry while distant objects may remain clear. 2. Mechanism. Hyperopia is typically caused by 1. Short axial length. A shorter than normal eyeball reduces the distance light travels, causing the focal point to fall behind the retina. 2. Flattened corneal curvature. A less curved cornea fails to bend light adequately. 3. Weak refractive power of the lens. The lens cannot sufficiently converge light rays. These factors lead to the inability to focus on nearby objects clearly, often requiring additional effort from the eye's ciliary muscles to compensate. References: 1. Foundations of Clinical Ophthalmology by Jack J. Kansky, an authoritative text detailing the anatomy and refractive errors of the eye. 2. Research article, Hyperopia and its Implications, published in the American Journal of Ophthalmology, emphasizing the physiological mechanisms and corrective approaches for hyperopia, the science behind vision. Think of your eye as a biological camera. 1. Cornea, the transparent outer layer similar to the camera's protective glass. 2. Lens, adjusts focus akin to a zoom lens. 3. Retina, acts like the camera film, capturing light and creating images. In a perfect eye, light focuses directly on the retina for clear vision. However, with myopia and hyperopia, this harmony is disrupted, leading to blurred vision at specific distances. References for further reading. 1. The Myopia Epidemic by Dr. Ian Morgan and colleagues. This book delves into the growing prevalence of myopia worldwide, discussing its genetic and environmental causes. This provides actionable strategies to reduce the risk of progression, with emphasis on outdoor activity and balanced lifestyle habits. 2. Foundations of Clinical Ophthalmology by Jack J. Kansky, a foundational text detailing the anatomy, physiology, and management of refractive errors like myopia and hyperopia, and widely used by ophthalmologists and optometrists for its clear and concise explanations. 3. WHO Bulletin on Refractive Errors. Published by the World Health Organization, this bulletin emphasizes the global impact of refractive errors and provides guidelines for diagnosis, treatment, and prevention. Highlights the importance of public health initiatives in combating vision impairments. 4. Clinical Optics by Andrew R. Elkington et al. A comprehensive guide to the principles of optics in eye care, offering deep insights into corrective measures for refractive errors, and recommended for both practitioners and students in ophthalmology. Don't miss out on eye health insights. Enjoyed this content? Hit subscribe for expert tips on vision care and better eye health. What hidden factors are behind myopia and hyperopia? Have you ever wondered what shapes the way we see the world? Why do some eyes focus too soon, while others miss the mark entirely? Let's uncover the fascinating causes and risk factors that define these common vision problems. For myopia, 1. Excessive curvature of the cornea or lens. 2. Longer than average eyeball length. 3. High refractive index caused by conditions like cataracts. For hyperopia, 1. Flatter corneal curvature or shorter eyeball length. 2. Reduced refractive index or lens displacement. Symptoms and diagnosis: myopia symptoms. 1. Blurred vision for distant objects. 2. Squinting and headaches. 3. Prominent eyeballs in severe cases. Hyperopia symptoms: 1. Eye strain and difficulty focusing on nearby objects. 2. Headaches after reading or prolonged focus. 3. Convergent squint in children. Diagnostic tools: 1. Retinoscopy uses light reflection to detect refractive errors. 2. Cycloplegic refraction temporarily paralyzes focusing muscles for accurate measurements. 3. A-scan ultrasound determines axial length with precision. Ready to transform your vision? Discover the best treatment options. Non-surgical solutions. Non-surgical treatments for refractive errors like myopia and hyperopia are practical, accessible, and effective in most cases. These include: 1. Glasses. The simplest and most widely used option, glasses are tailored to correct specific refractive errors. 1. They are highly effective in improving vision clarity and are available for all age groups. 2. Contact lenses. These provide a wider visual field compared to glasses and are especially useful for individuals with active lifestyles. 2. Proper care and hygiene are crucial to avoid eye infections. Supporting references: 1. Clinical Optics by Andrew R. Elkington et al. 1. A comprehensive guide to the principles of refraction and corrective measures. 2. Research from the World Health Organization, WHO, emphasizes that corrective lenses remain the gold standard for managing refractive errors in both developed and developing countries. These non-surgical methods are first-line solutions before considering advanced procedures, ensuring accessibility and effectiveness for patients worldwide. 1. Glasses correct vision effectively and are easy to use. 2. Contact lenses provide a wider visual field but require regular maintenance. Surgical innovations: 1. LASIK utilizes laser technology to reshape the cornea, ensuring quick recovery and minimal discomfort. 2. Photorefractive keratectomy, PRK, ideal for thin corneas, offering permanent vision correction. 3. Implantable lenses, alternative for severe myopia. Real-life case studies. Case 1. The young programmer. John, a 25-year-old programmer, struggled with progressive myopia due to prolonged screen time. After undergoing LASIK, combined with lifestyle changes like outdoor activities and regular breaks, he regained sharp vision. Case 2. The elderly artist. Mary, a 65-year-old artist, managed her hyperopia with multifocal lenses and Ayurvedic practices, including Triphala eye wash and dietary adjustments. Her vision improved significantly, enabling her to resume painting intricate details. What simple habits can protect your vision for life? 1. Practice the 20-20-20 rule. Every 20 minutes, look at an object 20 feet away for 20 seconds to reduce digital eye strain. 2. Incorporate eye-friendly foods. 1. Carrots. Rich in beta-carotene and vitamin A, essential for maintaining the retina's health. 2. Spinach. Contains lutein and zeaxanthin, antioxidants that protect against macular degeneration. 3. Omega-3 rich fish. Found in salmon and mackerel, omega-3s support the structural integrity of retinal cells. Recommended reading: Eat Right for Your Sight by Jennifer Trainer Thompson and Johanna M. Seddon, a bestseller that provides science-backed recipes and nutritional advice to enhance eye health. 3. Stay active. Regular outdoor activities can slow myopia progression. 4. Adopt natural remedies. 1. Acupressure, TCM. Stimulating BL2, bladder meridian, near the inner corners of the eyes can enhance blood circulation and reduce eye fatigue. 2. Triphala Eye Wash, Ayurveda. Using a mild solution prepared from triphala can help cleanse and rejuvenate the eyes naturally. Caution: while these remedies can complement standard treatments, consult an eye care professional before trying new practices. Improper use may cause irritation or harm. 5. Schedule regular eye checkups. Early detection ensures better outcomes. Join our mission. If you found this video insightful, tell me no by like, and share it with friends and family to spread awareness about eye health. Like, subscribe, and comment below with your thoughts or questions. Together, let's prioritize healthy vision for a brighter future.